I've obviously known you for a while, and this kind of as bad as it's been previously.
Probably worse.
Probably worse, okay.
I totally crashed.
I lost my husband.
Oh dear.
I lost him 8 months ago.
There was a lot of thunder last night.
Sure.
I think so.
You've been drinking last
I
night?
could have been dreaming.
So let's have a look at the site, just make sure there's no obvious signs of infection. Oh gosh, sorry.
That's quite sore.
Sorry.
I've just been like trying not to get anxious about it.
I know. Either way, you don't leave A&E until a neurosurgeon's seen you.
Okay.
Good morning, Nana speaking. How can I help?
Come and have a seat for me. Did it say on the screen where I'd be?
Number 12, yeah.
Yeah.
You're usually around.
I am. I'm normally in 8. Right, how are you getting on?
Not very well at the moment. It's like this down my neck here and down my back. I mean,
Oh, what's happened?
it's given me a lot of pain. I'm in serious pain, and I'm getting. I thought it'd start healing by now. The only time it doesn't hurt is when I'm laying flat in the bed with no pillows. And
Right.
it's perfect.
So, what
See,
should
the
we...
awkward part now is my old company, because you know I was made redundant.
Yes.
They phoned me up yesterday. Can I go back to work for them?
Oh,
And I said, well, I don't know, because the way this is at the moment, I don't know how much work I can do.
yeah,
I don't want to make it worse. I want this to clear up.
yeah.
No, I want to go back to work because I'm bored watching daytime television.
Yeah, I can imagine. I can well imagine.
I started doing the hoovering and that the other day, and then I had to stop because it was just like trying to mop the floor. When I've been like that, trying to mop the floor
Oh dear.
and things like that. And she said, leave it.
Shall we have a look at your
You
neck?
can do.
Can you whip your jacket and your T-shirt off and just... So let's have a look at the site, just make sure there's no obvious signs of infection. Oh gosh, sorry.
That's quite sore.
Sorry.
It's that side more than anything around there, yeah.
All right. Let's just work down your spine, make sure you've got no kind of... So that's sore there, isn't it?
More that side, the back and neck, yeah. There, yes.
So that's right over your muscles. Your muscles are very tight there.
Ah.
Okay. Can you have a seat on the couch for me, just on the edge? Can you show me what neck movement you've got?
That's
That's
about
quite
there.
bad. Can you make a stance like that for me? Can you push up really hard?
Ah.
So that's hurting
Yes.
as well.
And that hurts that side.
Oh dear. Oh dear.
Well, came to backside, aren't I?
Feel free to put your things on. Come and have a seat for me. I think that what's probably happened is that, you know, you've had this operation in your neck, but all your muscles are really tight and really tender. I think we need to get you some decent painkillers because it's clear that it's quite bad.
Now, what about going back to work on Monday?
I think if your pain is under control, there's no reason why you can't go back to work.
Right.
What we should do is give you some tablets called naproxen.
I know naproxen.
See how you feel. If everything's fine, you're okay to go back to work. And you can move your head so you're safe to drive.
I'll be well enough.
If not, you'll give us a shout and we can always try something different.
Okay.
Okay?
Fine, yeah.
Hello. Come in, Mrs. Rice. Come in. Take a seat.
Oh, it's warm in here.
It's quite warm in this room. It is a little bit. But did you hear all the thunder last night?
What?
I didn't. There was a lot of thunder last night.
Sure.
I think so.
You've been drinking last night?
I could have been dreaming. How have you been since I saw you last?
fine.
Okay.
See, my dog keeps me well because I have a proper walk twice a day.
Okay. How is the walking at the moment?
Fine. My knees okay. It's
Yes, I notice a
problem.
change.
What?
I notice a change.
What?
In that,
I
a
use my
year
stick.
ago, you weren't using your stick
Yeah.
and you didn't need to.
Oh.
And now you're taking it out with you a lot.
I think it's more for safety.
And I'd say 5 or 6 weeks ago, you were really struggling with the knee, particularly in the morning, the right knee, which I think is the one that hasn't
Yes,
been
it is the right
replaced.
knee. This one is definitely stiff.
Okay.
And you see, I'm using my stick in that hand. Oh, yes.
Okay.
But it's all right.
Are you taking any painkillers on a regular
No,
basis for
not
it?
sure.
No, yes,
I think-
mother's brain is 100%, but the memory is shot, isn't it?
Indeed, yeah.
I still get corrected for incorrect grammar.
Yes.
Good.
I
Good.
What we'll do is we will go down the route of a very small dose or a half dose of a medication called naproxen, which is an anti-inflammatory.
I think I've been on that before.
Have you?
That rings a
You just
bell,
have
that
the
drug.
same. 2013 you were on it last.
What year are we now?
15. So, yes.
Should we do that for a couple of weeks, just trying as a big...
That's for the neck, though.
No,
We're going to try it for the knee on this
Okay.
occasion.
Oh.
But I think if we can improve this knee,
More dog walking.
keep you walking the dog, that's the most important thing.
But I do keep walking the dog twice a day.
You do.
And then we can always discuss further about whether or not we do anything different next time.
Oh, but it's not bad.
Well, failing that,
not
we can
bad.
go a little bit further and do an amputation. That might help.
You're full of bright ideas, aren't you?
Let's do that. Okay? I'll see you in
You can have one of those mobility scooters.
see you in a number of
Oh, I
weeks.
wouldn't mind that.
Don't forget your stick.
Oh my God. Thank you.
Indeed.
Okay.
Pleasure to see you again.
Bye-bye.
Indeed.
Thanks a lot.
Take care, Mrs. Rice.
Hello.
Sorry, we've got everyone.
It's an outing for the day. It's quite chilly in here, boys, just to warn you. Hi, Cutie, you come. The full works. Look, there's something underneath there to keep you occupied, mister. Why didn't you get that out and have a look?
So Lisa came to the surgery about a month ago to see my colleague, Dr. Sara Glynn, complaining of severe pain down her right leg and numbness around her bottom. And Sarah assessed her and sent her as an emergency to St George's, where she was admitted for an operation that day to have the pressure of the bulging disc on her spine released.
The pain in this one's still extreme, really hurting.
Just catch me up, love, because I haven't seen you for a long time.
Right, no.
So
Go from when you come out from surgery.
just give me a brief update, because you've had
Round my
operation,
back.
didn't you?
Yeah.
Okay.
And it was to remove a disc that was going into my spinal cord.
Yep.
This one's now started, my foot started going numb.
Right.
And the bottom's really aching, and my hips.
It's almost like the same.
Especially
same
when I go
thing's happening
poo.
again.
When I'm going toilet,
Yeah.
it really hurts.
So when you go to the toilet, I know it's graphic, but explain to me exactly what happens.
Like when I'm going to poo and the poo's coming out, it hurts around my hips.
Okay.
And it just generally I hurt around my hips.
Right. And was that hip pain there before the operation?
No.
Not at all?
No.
So this is a completely new pain?
So I was quite alarmed by how severe Lisa's symptoms were a month after her operation, and I was worried that either the disc had re-protruded or that something more serious was happening.
So I'm just checking for sort of sugar, protein and infection.
What's it like when it comes out? Is it hard? Is it just like a sausage?
Sometimes they're a bit like this.
Okay, okay.
Sometimes even when I sat down, you could sort of feel parts of the bowel moving.
Any bleeding from the back passage?
Not that I've noticed.
Okay.
Does it burn or sting when you pass urine?
It was change colour.
Okay.
In the meantime, can I get you to go and do a urine sample for me today?
Right, how can we help today?
Lots of little things.
Okay.
Right, okay. My wee is smelly. It's I don't know, it's a bit sort of marzipan-y. I can't really describe it, but it's not right.
Is it just a bit dark?
Yeah, but it's got a really strange smell.
Okay. You don't think you could squeeze this out a little bit now, do you?
Probably, yeah. The other thing was, I've not had a prostate check at any point. I was wondering whether that should be something I should be looking at doing.
What do you mean by prostate check? Do you mean the actual rectal examination or the blood test?
Blood test, I guess.
The only thing I caution a little bit with the blood test for prostates is they can sometimes be a little bit elevated. The problem is if it comes back with a slightly intermittent value, we're then kind of obliged to refer you for investigation.
Well, okay, I mean, if you're doing a blood test, if it is bad, as you say, then you carry out the test.
Which, unfortunately, means a finger at the back passage. Do you think you could try and do a sample? The toilet's just next door, actually. And we'll go from there. Great, successful. Thank you very much. Right, shall we get the prostate examination out of the way? You need to drop your trousers and your pants, and then you need to line your left-hand side facing the wall. And then you bring your knees up to your chest. So it takes about 30 seconds maximum. Okay, so bring your knees up as much as you can, that's grand. Okay, so a little bit of pressure. That's good. And I'll leave you to wipe up and things, and that's all there is to it. So your prostate feels normal. It doesn't feel enlarged. It feels smooth. With the blood test as well, if they're both normal, then I think we won't. Your urine sample's normal, by the way.
Is it? Yeah. What was the smell for them, do you think?
Probably dietary was the most common reason. So I'm going to do that PSA, so that's prostate-specific antigen. So that's a little look for the prostate, and I'll just check your renal function as well, seeing as you said that there's been a bit of a problem with your sort of smelling of your urine. So
yes, okay.
It won't hurt just to check your kidney function's okay.
Great. That's brilliant. Thank you so much.
I think we've covered everything.
Okay, well,
just about.
Thank you. Nice to meet you.
Yeah, and you.
Thank you.
We've given you a bit of a once over, haven't we? Nice to see you. Take care.
Let's just get you on the couch, my love. Have a little, just your legs raising up.
But I did have another pain as well today that shot from my scarf thing around my side here.
Any problems in terms of if you wipe yourself?
Yeah.
Does it feel numb at all?
I can't really
Around
feel
that
it.
bottom
Yeah,
bit?
it does feel a bit numb.
Just gonna have a little feel down there as well. I hope you don't
Okay,
mind,
no
just to
problem.
see where we're up to, because I think that is more telling.
No.
Just try and raise this leg up for me. Gently, gently, gently. Does that really hurt?
Yeah.
Was that, when we did that before this op, did that used to hurt like that? So this is all new on this side?
Yeah. It's just, trying to describe the pain and everywhere, it's just in my bones.
Like a real gripping pain, sure. Right, just turn onto your side for me.
Ready?
Okay. So if I touch you here, does that feel normal or does that feel a bit weird?
I can't really feel it. I
can't feel it.
I can feel it, but you see when you went up there, I can feel that more. Yep,
So
definitely.
if I'm up here,
yeah,
that's
I
more
feel that.
normal. It
Yeah.
feels, that feels
Then I
numb,
can't
does it?
feel, yeah.
And that left.
Okay.
1, 2, 3, 4,
Squeeze my finger.
5, 6, 7, 8.
Tight as you can.
You do a digital rectal examination in a lady like this in order to see if she could squeeze my finger to feel if there's power in her sacrum power to enable to squeeze my finger. And she really wasn't able to, and that's quite a severe sign that there's something wrong in the spinal cord and it needs to be seen by a neurosurgeon urgently.
Yeah, okay. I need to get them to see you, my love, I think. All right.
Yeah.
You take a seat.
Okay.
If you ignore those kind of signs and symptoms, people can go on to become paralysed.
This
Not
bottom
normal.
symptoms are not good, so we need to get to sign something going on the discs. They need to reassure us.
Yeah, because I've just been a bit worried, especially I suffer from anxiety. So
No, I know you do.
I've just been like trying not to get anxious about it.
I know.
And I don't like to complain about pain. do I?
No, but you have every right to be anxious. We will get it sorted, don't worry, but we need to,
Okay.
action, okay?
Gary's has to keep an eye on my medicines as well that I take.
So you need all that?
Yes, please.
Right, 1 second.
Yeah.
That can wait just for a
okay.
sec. I've got to speak to the neurosurgeons and see if I can get them to see you today, okay? If you guys go back to the waiting room.
Yep.
And I'll get on and chase.
Okay, because we've got to go to Sainsbury's. Shall we come back after that?
I mean,
Why don't you wait?
Yeah.
Let Gary take the boys to Sainsbury's and I can call you back in when I'm ready.
All right, yeah,
once I know what the plan is. All right. They can just be a bit of a pain to get hold of, so it might take me a few minutes.
All right, that's okay. That's fine.
All right. Hello, could you bleep the SPR for neurosurgery at the GP? Yes, please.
Hello, hi, is it Helen? Yes. Yeah, I'm Sian, one of the doctors here. Come in. Are we taking out an implant?
Yes.
I'm doing a contraceptive injection.
Yeah.
Okay. So I'm going to pop your head at this side.
Yeah.
Oh, lovely and superficial. Easier to take out. Okay.
The first one I had didn't come out properly.
Oh, really?
Because the muscle fibres attached to the implant, it was too hard to take out.
Crikey.
Yeah.
Sounds traumatic. So, scratch coming up. Okay, we'll put the local in. What I'll do is, before you go, I'll just have to double check if it's going to work straight away for you, if you need any additional precautions. So, local anaesthetic takes away sharpness, doesn't take away pressure. Does that feel sharp?
No.
No. Okay, let's try. Oh, you bleed a lot, don't you? Yeah?
Yep.
Okay, it's out. It was nice, quite easy actually.
Oh, nice.
Right, so I'm going to put some steri strips on. Now I'm going to put a dressing. So if you find this too tight, you can just loosen it off a little bit. Are you feeling lightheaded? No? Okay, right. So if you lie on your front, and then can you just loosen off your trousers just to about just middle of your bottom? Oh, you got the right knickers on today.
Yep.
So I'm just going to clean the area. Yeah, okay, so I'm going to pop it in now, okay?
Yep.
Okay, well done.
Cool.
Okay.
Cool.
I'm going to double check that it works straight away, and then you can go. There you go, correct. No additional precautions required.
Thank you very much for today.
Pleasure.
Thanks
See
very
ya.
much.
Hope it suits you. Bye-bye.
Okay, I'm probably going to have to go in a minute. Will you just say to them that a GP sent someone via A&E now? Thanks ever so much. Bye.
You know, our hospital colleagues are incredibly busy and pressurised as well, so it may come across sometimes when we're waiting on the phone to speak to them that we're frustrated with them, because we are, but equally, we know that they're very busy. You know, you do everything you possibly can not to send people to A&E, and most of our patients don't go anywhere near hospital. But when you've been a doctor for a long time, you do get a sense of who needs to go in and who doesn't.
All right, my love. I've just been on the phone all that time to them. Come on, have a seat. I'll tell you what the plan is. Have a seat. So I've just tried to phone and nobody's answering.
Yeah,
It's just
they're normal.
They're normal. They're probably in surgery. So I've told switchboard when they get back to say that I'm sending you via A&E. I've written a very detailed letter. Now, because you were their patient so recently, hopefully we won't have this difficulty like you did the first time before anyone took it seriously and actually suddenly rushed you in. I've just been reading back, my goodness, it was all very rushed, wasn't it? Real emergency.
It's because I suffer from anxiety, so I don't usually come to the doctor too much.
So I think hopefully the red flags, as soon as they hear your name, will be like, oh, we need to see this lady.
Right.
Either way, you don't leave A&E until a neurosurgeon's seen you. Okay. That's your remit from me. All right.
Okay.
But that numbness around your bottom, the fact you couldn't squeeze my finger. I think so. And it maybe they just do another MRI and see if things things are just inflamed, because they could just be inflamed. But it's just those bottom symptoms that really worry me, because and when you tried to squeeze my finger, you couldn't, and that's a sign that something's not quite right. Okay?
Yeah.
So take it easy, steady down there. It's going to be a bit of a wait. All right, I really hope it goes okay. It may just be a case of almost them just giving me some sort of strict advice on how we let this settle again, but I just want them to check. I think you're probably going to need another MRI at the very least.
All right, okay.
All right, take it steady. Bye.
I got to the bus stop. There was like 80 people at the bus stop.
Yeah.
I waited. For like 10 buses came past. They were all full. Nobody was getting on the buses. I thought, after this, I'm going home to get my car. Got to my road, Gordon Road.
Yeah.
From the bottom, the queue. And then even when I got onto the top with the Old Town, traffic galore.
Hello, hi, is it Patricia? Hi, I'm Sian, one of the doctors here. Come in. Sorry, I've kept you waiting, so I do apologise.
I was just glad to get an appointment today. Yesterday, I was at work about 5:30, or I went to pee maybe at 3:30, and then ate to pee again.
Yeah.
And my gosh, from then on, all night, it was terrible. I mean, just the urine's clear. I drank a lot of water. I was so desperate.
So the main symptoms is going a lot?
Yes.
And also, did you say it's hurting when you go?
Some, but not excruciating.
Do you mind if I ask you to do a urine sample?
Yeah, not at all.
So the toilet's just there.
Can I do it now?
Where is it? Just here, literally. Great. Have you ever had this sort of problem before?
Long time ago.
Is there anything that you think has set it off this time?
No, I'm under...
Oh dear.
I lost my husband.
Oh dear.
I lost him 8 months ago. Yeah, he was diagnosed last August. He was diagnosed at first with pancreatic cancer, but no real clue, and he died 3 months later, but it was melanoma. At first, the symptoms. So I think, it might be stress.
Yeah, there's
that
some
if
tissues
it's
there.
the,
Oh, God,
just,
how awful.
Yeah. So it's 33 years.
Oh, you're together, that's a long time.
And just so fast. He died at
awful, isn't it?
Trinity Hospice, which was really nice.
Okay.
I see that. You're proud.
Sorry.
Obviously not too well, but...
No, it's my hay fever. I'm finding it hard with my breathing. I usually just get sniffly and my eyes get watery and...
Okay. It should dry out.
Yeah?
Just one.
Just one.
My right eye keeps flaring up. I've not been tested for any allergies.
Is it sticky in the morning or not?
Give a date of birth, please.
So what brings you in today? What can we do for you?
Well, actually, every day I'm taking the pills because I'm allergic and I run out of my pills. And here, if I want to get it, then I need a prescription.
Okay.
And that's why I'm here.
When you say you're allergic, what are you allergic to?
Oh, pets, dust, how they call it, the small animals.
Small animals, did you say?
Yeah. Mates?
Yeah, so that's the mites.
Yeah, mates. Yeah. For that, and wormwood.
Wormwood, okay.
Yeah. And the pets.
Pets,
and
what kind of pets? Like furry,
dogs,
cats, dogs?
Cats and dogs.
Okay.
And dust.
And dust, okay.
Yeah, this is what I know.
And so did you have some allergy tests?
Yeah. But that was years ago.
Okay. Did you have skin testing?
Yeah.
Okay. And what kind of symptoms do you get with your allergy?
Sneezing, for example, I have like, eyes, if you have like...
Watering?
Yes, a little bit.
Okay, so sort of like hay fever type symptoms.
Oh, yeah, more or less.
And you've never had any breathing difficulties or swelling in your lips or your tongue? That never happened?
No, I haven't seen that.
All right. So your purpose today was really to get some of this medicine?
Yeah.
Okay. Trying to just take the antihistamines on a regular basis when you need to. If things are better in winter time, then you can obviously don't have to take them every day.
Only solution is to maybe move to Alaska,
That's an extreme one, but yes.
And how are you managing or coping?
Not that well.
Yeah.
But I'm seeing counselling at Trinity Hospice because they offer that. So I see somebody weekly.
Okay.
So I'm just kind of, I'm just inching my way.
Does that help?
I don't know what helps.
No. How's your mood most of the time?
It's all right. It's pretty okay. I mean, I'm just getting stuff done. But it's hard.
Yeah. I think it's important to say that, bereavement is a natural process and it's a normal process. And she was going through a normal bereavement process and she's getting, very, very specialist help. You can't get much better than a bereavement counsellor from a hospice to give you the therapy that you need. So I felt sympathetic towards her and I felt for her, but I wasn't overly worried about her.
It's just so sudden.
It is so sudden. And out of the blue as well, isn't it? Gosh.
So what does that say?
It's quite clear, actually. Just a trace of some inflammation.
So maybe okay.
I'm going to give you a prescription, but I don't think you should take it to the chemist.
Okay.
Because I actually think that you're going to get better. This sort of thing, it's more of a simple inflammation. Yeah.
All right.
Good.
That's it.
Yeah. Good.
Okay. Thank you very
All right.
much.
Look after yourself. And if
Okay.
you feel your mood does drop or if you need extra help, other than talking therapy, let us know. Okay?
So much. Okay, thank you very much.
Okay, take care. Bye-bye.
Erin speaking, how can I help?
Okay, take a seat. How can I help today? Oh, okay, this is your 6 week?
Yes.
6 weeks after. Okay, lovely. Where's baby now?
She's with my sister.
Oh, I always like seeing the baby. Okay, so how did it all go?
Quite good, yeah, but
Yeah?
I've got some pain in my back.
Okay, so let's start by telling me about what happened with the birth. Did you have an episiotomy or any tear or anything down below?
No, I just before I born, I had high blood pressure and high temperature.
And were you well after that?
I had temperature,
You did?
even baby had temperature.
Okay.
So I took antibiotic and she took antibiotic. Even when I get off from hospital, I was there like 4 days.
And how do you feel now? No more fevers?
Yeah.
Opening your bowels okay and passing urine okay now, yeah? And have you stopped bleeding?
Yeah. I bleed like 1 month. And after it was, just a little bit dirty.
Okay, and now it's stopped, has it? Good. Okay, all right. And how are you feeling in yourself? Do you feel like low or depressed or anything like that?
Sometimes, yes, because I separate as well now with my husband.
Oh no.
Yeah.
Okay.
So.
When did that happen?
Last week.
Really? Oh no, okay. What's happened? What happened with your husband?
Sorry.
No, it's okay, here. Here you go. I'm sorry.
But I know I have to be strong for my children.
Oh, I'm sorry. Okay. Do you have? You said you've got your sister. Does
Yeah.
she live with you or?
Yeah, she helped me a lot.
Okay. Sorry. Do you think maybe you could do with some counselling and some support for you?
No, it's very fresh. That's why.
Of course.
We are in a very difficult situation about home as well.
Oh, really?
Yeah.
What's
Because
going
we are now in temporary accommodation. Before we've been in bed and breakfast for 3 months. It's getting worse and worse.
Well, look, if at any point you feel like you do want support and someone to help and like to speak to counsellors, anyone like that, we can arrange that for you, okay?
Maybe.
Maybe if I give you the telephone number,
Okay.
then you can think about it and we can go from there. Okay?
Okay.
In 1 week time, you come back, I'm going to give you the number for some counselling because I think it's good to speak to somebody when you're going through so much. It's hard to look after a baby and look after yourself and find housing and all of this all at once. You need some support, okay?
Okay.
So, here is the number for counselling, okay? If you feel like you need it, please just call them.
Sure.
Anyone else,
Thank
that's
you.
okay. Okay.
Thank you very much.
You're welcome.
Thanks a lot for
Bye.
your help. Thank
You're
you.
welcome. Bye.
What can I do?
I think it's growing pains, but every time I try and walk, this leg hurts.
Okay. And when did it first start to hurt? Can you remember?
I think maybe a good few months.
A few months?
Yeah,
Okay.
and then it goes away. I think it's probably about the 3rd time it's come back now. Did you ever fall over and bang it right at the start?
Well, right at the start, I had a massive bruise on my knee, remember?
Yeah.
So possibly she might have hurt herself at the start of all of this.
Potentially.
Can I get you, could you mind coming up here?
Happy
I lower a bit.
Last time I went here, I could not get up by myself.
That just shows how well you're growing, doesn't it? Okay, let's have a little look. Can I just bend that knee a little bit? Is it sore there? Yeah, that hurts. Now, can you bend this leg for me as far as you can? Okay, so you can only get to there. And then can you try and straighten your legs for me? That's great.
No, she won't do it fully.
Yeah, and yeah, not quite the same as it on that side. Okay, fine. I'm going to let you come down, okay?
It's a bit of a mystery, isn't it?
Yeah, it is. I don't know right now what's going on,
No.
but I think you're quite right that we need to make sure that there isn't anything serious going
Yeah.
on, like certain types of arthritis and that sort of
Okay.
thing. It's very unusual in children,
Yeah.
but you can get it. So I think what we need to do is to definitely get you seen by a special doctor at the hospital, and it will be to see a special doctor called a paediatric rheumatologist, which is a children's joint doctor, essentially.
So that we'll just hear from them, and if we hear from you guys in a few days about when an appointment is.
Well, yeah, it might take a little bit longer, but I'm
Okay.
going to ask for an urgent appointment.
All right, brilliant.
Just
Okay.
because if it is something more sinister, generally the quicker we pick
All
it
right.
up, the better. Okay?
Thank you very
All
much.
right, pleasure.
What do you say to the doctor?
Thank you.
All right, thank you for being a good girl as well, okay?
How's your cold? Is it getting worse?
It's not getting worse. I think it's more... It's just more here. It is well with my soul. It is well.
Hi, Erin. Come on in. Come and have a seat. It's very nice and cool in here, yeah. So I saw that you saw Dr. Glynn. Things haven't been going well.
No, that was terrible.
Aaron's a patient who I've been treating for several years with depression. Unfortunately, things have got much worse for him recently when he became a victim of cyberbullying. He was booked in to see my colleague, Dr. Glynn, who assessed him and found out that he was having trouble with his sleep and was particularly agitated. So she prescribed him a short course of sleeping medication, and he came back to see me a few days later to see how he was getting on.
I took one of the sleeping tablets that she gave me.
Mm-hmm. Okay. What happened with the diazepam?
Wow, no, I can't take them. I'm still not right now.
Mm-hmm.
It's like woolly-headed,
Okay.
can't function. It's like, and the dreams were,
Okay.
to say they were lucid is
Yeah.
an underestimate. You know,
Okay.
it's like nightmares,
Mhm.
proper nightmares all the time. And I was like, oh, no. And even in my dream, I'm saying, this is the medication that's
Mhm.
doing this. It's the medication. And I was
Okay.
like, I don't like this. And I just can't come round.
Mhm.
You know, it's maybe that's a good thing.
So I've obviously known you for a while,
Mm.
and there's been times when things have been really bad for you before.
Mm.
And is this kind of as bad as it's been previously?
Probably worse.
Probably worse, okay.
Because this has walked back all the feelings I had at school,
Mhm.
being bullied at school,
Mhm.
and not all the way through my life, but a lot of the way through my life being bullied. And I was sort of hopeful that it was feelings that I could bury,
Mhm.
but I totally crashed.
I used to go to the pensioners club down there, but it's full of old people, so I don't like it.
I want to do a bit of very gentle exercises and training for older people, and the man that's going to do it is an ex-Marine.
Oh, wow.
I feel okay, I'm going to do Zumba today.
You know my type, I live for today and that's it. What happens tomorrow is what happens tomorrow.
Thank you very much.
You're tired.
Do I look tired?
You do this morning.
I didn't have a good night last night, sleep.
So in 9 years you haven't put on any weight, which is amazing.
Is it really?
Yes.
I should, I'm a geriatric toy boy.
Hello.
Hello. You're waiting for us. How are you?
Good, thank you. And you?
I'm not too bad. It's him that's in trouble.
Hello.
On the worst state I've ever been.
From
Everything's gone wrong.
Everything's gone wrong.
Oh, I'm
Okay.
really in a shocking state. A couple of weeks, well, this all sort of started when I very foolishly overdid it.
Okay.
And since then I've had so many problems. I've had terrible electric shocks in my hand.
Okay.
Both shoulders. This one was really no. What else is there?
Can't sleep.
I can't sleep.
Because of pain or?
I don't know what it is. You won't read that. I can't write properly because I think.
No, it's quite clear.
Hey?
Yeah. So hands,
scribbling. Yeah, the hands.
you talked about, and it's swollen.
Yeah, they're swollen.
Then you got more. You
No,
got
I
your
haven't.
legs.
Well, the
Swollen ankles and
ankles
feet.
and legs and feet.
His ankles were very swollen last night.
So when you go to bed, it's swollen.
Yeah, oh yeah.
And in the morning when you wake up, is it less swollen? Or
Less swollen, but not still not down the back. You see the difference?
But you're kind of retaining fluid at the moment.
Yeah, I
This
know.
is all fluid.
Yeah.
And similar with your hands, I think. There's a lot of inflammation all over. So I think we can't cure that inflammation easily. The shoulder injection obviously will only treat that one shoulder.
I realise that.
But sometimes if we get pain better in one place, the rest of them somehow gets a bit better.
Oh yeah, yeah.
So I think it is still worth doing
Oh, I
this
do,
injection
certainly,
today.
yeah, definitely.
Hopefully helping all the others.
Yeah.
The other thing is another tablet you had before, it's been a while, called amitriptyline. It was a night tablet.
Yeah.
It settles down nerves, so it will settle down these sharp nerves that you're getting here. But even your leg pain nerves, all these nerves can actually get settled down with the amitriptyline.
Oh, that's good, isn't it?
Oh, it'd be wonderful. if
Let's
I could.
hope it does.
Yeah.
So, what do you think we do?
Well, I don't know. Do I need to see a psychiatrist?
Hmm.
You know,
I think actually seeing a psychiatrist would be a sensible thing to do.
I know I'm on the maximum of metrazapine, you know, and by and large it does work, but when things are bad,
Mhm.
it doesn't.
Yeah.
It really
So I think that's probably true of all antidepressants. You will still have ups and downs on it. It can't stop bad things happening in life.
No.
So for Aaron's case, I think it's a combination of managing his moods with medication, but also looking at things that he can do to support himself with the people that are around him, with his work or employment, and keeping him busy and active is probably the best thing to help his mood as well. I think actually things would probably be worse for you now if you weren't on antidepressants, but yeah, I think it's getting you some extra support is really what you need. Okay. In which case, let's thinking about sorting that out. So if I write to Springfield and ask them to see you, okay, it will probably be in the next few weeks, okay? And so we'll have the understanding, obviously, that in the meantime, if things become more difficult for you, then you just contact us, and either myself, Dr. Glenn, one of my colleagues would be able to see you.
Lovely.
All right.
Okay then, thanks a
We'll get
lot,
this sorted.
Doctor.
Okay, take care, and bye.
The annoying part, I was reasonably, like, I know for my age, I mean, I'm 84, so I don't expect to be
running.
Yep. Yeah, it's unfortunate, isn't it? Something small triggers so many things.
Yeah, he's had so many things happen to him that he's got through.
Yes. So
But we get through it all.
Right. If I can get you to come here, I'm going to move your chair.
Oh, sorry, I've got to move down the way.
And if you have a seat there, don't knock that, because I'm going to go around on this side.
I think I'm just wearing out.
He can't do all the things he wants
Can't
to
do anything that I want to.
Okay. All right.
Yeah, you carry on when you're ready.
So you'll... All done.
Lovely.
How was that?
No, no problem. Lovely. Yeah, no problem, I promise. Oh, that's good.
Bad arm first.
Yeah, let me do these. Right. This is the trouble, she has to dress me.
Yes.
She used to undress me when we were much younger, but...
Don't be rude, Frederick. Well, after having 5 children and
That's why we had 5
grandchildren,
That's why we had 5
get used to undressing and dressing.
But you don't do it properly. You tuck your shirt in your pants. You ought to know that by now.
So, fingers crossed with this shoulder injection.
Yeah.
And the amitriptyline night tablet. It's usually one of these things with arthritis or with joints. What happens is they go through flare stages, and every now and again things swell up and then they settle down again. So I suspect that's what's going on.
I really cannot, I'm not happy with this. They're not like me, I can't get up and down.
You're such an active person.
Well, I try to be.
Yeah. So hopefully the injection and the amitriptyline will help the moving.
All we want to do is to keep going.
Well, that's
Yes.
all really.
Yes.
Okay then. Many thanks.
No problem.
Well,
All right.
I hope I don't see you in a fortnight, but I don't want to go in a fortnight.
Yes. Okay. All right then. Bye bye.
Who's on call tomorrow? Please tell me.
Your mum and dad.
Mum and dad.